I'm Jim Gordon, co-host of the weekly television show Our City Tonight. I'm pleased to be back here working with my colleagues from the Richmond Sentinel. As a matter of fact, we're in the office of the Richmond Sentinel right now where everything takes place. Over the last 3 years, we have produced a number of video segments, including the BC referendum, the municipal and provincial elections. We feel that these segments are important to the citizens of Richmond. That's why we keep doing them. And it's been a while since we've done one, but we're back doing them now. And we're going to start with one today and a very important subject. It is Richmond's COVID-19 vaccination progress. Joining us today, our guest is Bob Chapman, Interim Vice President, Vancouver Community for Vancouver Coastal Health. Bob, thank you for joining us for this discussion with the Richmond Sentinel.
Thanks, Jim. Great to be here.
Bob, it's great to have you here. Thanks for taking the time. We know you're very busy at the moment with all that's going on. Okay, let's jump right in. I believe from my calculation, we're about week 4 right now with the rollout of vaccines here in Richmond. For our viewers out there that want to know more, tell us about how it's gone so far.
Sure, no problem. It's actually been a pretty exciting 4 weeks from the campaign that started originally in the middle of March with our over 80 seniors and our over 65 Indigenous population. As the weeks have gone on, we've actually brought a number of different clinics online, including in Richmond. Some of those are what we call our pop-ups or short-term clinics. And we opened up the River Rock, which will be our clinic that runs 7 days a week for the entire campaign right through into the fall.
And I was reading the other day, Bob, here in Richmond, that you have adapted kind of an ambassador program with some of the staff from YVR who are helping out with the process, lineups, monitoring. How has that gone?
That's been a huge opportunity. It's a great question for us. We have partnered with a number of different organizations at all of our large clinics, like River Rock. So you are correct, YVR is our partner there, and they are definitely ambassadors. We often refer to them as our wayfinders. They're probably the people that the public first see when they arrive at the door. They're the people that will welcome you and that will actually help you figure out where to go and then help you register and start your journey through the vaccine process. So they've been an incredible partner, extremely welcoming. We've had very, very positive feedback about how accommodating they have been and how receptive they have been to the public. And it's just great to have a partner on board like that.
I think what's great too, Bob, is and I cite my parents as 2 examples, that I think people were somewhat apprehensive. But the feedback I'm getting, say, from people like my parents, their friends, and other friends I have in those first categories is that it has run very, very well. Will you be in a position where you may need more volunteers? And if so, how would people find out more information on how they could help?
Yeah, we do have volunteers running at a number of clinics as well. We actually have had some really good feedback from the public who have come to say that there was a lot of people there to help and assist them, which is actually what we want to happen. We want this to be a positive experience. There is a lot of anticipation and excitement by the public about coming to get their vaccines. It's opening a door in this journey of the pandemic for them. And really opening up some huge opportunities for them. So there's a lot of excitement. And I think if people are wanting to be involved, we absolutely do welcome volunteers. There have been some specific volunteers we've targeted and put in place, like volunteers that speak different languages for the populations we serve. So that's been also an extremely helpful addition to our workforce that are helping us in our clinics.
And Bob, as more vaccines come in, the amount increases. Will you increase hours? I know I see a lot of things on Twitter where people going, if they were doing it at 3 a.m., I'd be there at 3 a.m. Can you talk a bit about that? And will there be more locations in Richmond?
Sure. We don't actually have clinics planned at 3 a.m. right now, but we do have clinics running about 12 hours. The staff are booked for about 12 hours. They're running for about 10 hours of immunizations or vaccinations. The River Rock, for example, in Richmond is running 7 days a week. It is going to be what we consider one of our larger clinics in that community of care, and we'll continue through the whole campaign with those kinds of hours. We do have the capacity in all of our clinics. Some of the reasons they were chosen are the ability to scale up with more immunization stations, so that we can actually support more people being vaccinated per hour. And we will actually flex up depending on the age cohorts of who's being invited for their vaccines. There is not the same number in every age cohort being invited. And so we do actually know as the population ages change, that we have to increase our ability to larger numbers at certain cohorts. So we will actually scale up some other sites in Richmond as we need to as well to support that extra need for the capacity, depending on what age cohort we're moving into. But River Rock will be one of our Sentinel sites that will be there with those hours I mentioned right through the whole campaign.
I was by there today, Bob. Line was moving quite smoothly. It was a big line, but it was moving quickly. That's always good to hear. Hey, we're talking with Bob Chapman. He's the interim vice president, Vancouver Community for Vancouver Coastal Health. You want more information? It's easy to do so. Just go to vch.ca or 1-877-587-5767. Bob, at the time we're recording this, we are in the early stages of another kind of semi-lockdown for April, running until April 19th. In-house dining, house of worship, gyms. We know this, we've done this a number of times. Can you talk a bit about the challenges that you run into? And as I mentioned earlier with social media, it seems to accelerate things so much faster. How are you guys adapting weekly and often daily to these challenges that come up?
I think that one of our core needs is for the public to remember that when we are going through these different periods where there are more restrictions, if you think about the immunization clinics, we will ensure that we manage those clinics by appointments so that we can control the numbers of people that come per hour, so we can keep social distancing through our clinic experience, and that we can ensure that people are not put at risk for COVID. So I think those principles, the principles washing your hands, wearing a mask, no matter what's happening, and will continue to be core things that we need to continue to enforce through this stage, and as things possibly change in the future with the numbers possibly going back down again.
Bob, I wanted to touch on this due to the background. You've done so much since joining Coastal Health over 20 years ago. Support in operations, community health services, community health centers, home health, mental health, substance abuse, primary care, long-term care. I have to ask you, with your experience and expertise, can you talk a bit about the closely monitoring you're trying to do in terms of mental health and long-term care and substance abuse? This has been very difficult for everybody, probably more so with people that were suffering from these ailments before COVID.
Yeah, that's a really good question, and I think it's certainly as a community, for all of us in British Columbia, we really have to think about the impact of some of the restrictions you just mentioned, the isolation that people have experienced. We know even for the seniors who have come to the clinics, some of them have been quite emotional at receiving a vaccine and have really wanted to have a social engagement and talk while they're there and talk about the fact that they haven't left their home in a year. Other people have struggled, as we know, with some of the isolation and the measures. It's definitely been a difficult change. And for some of the clients that we have, it certainly has been difficult as well. And we know that we're trying to support them in different ways, through crisis lines, through our normal mental health services. And we need to all be aware and just, think about people around us and indications that they may not be coping as well, that they're more agitated, they're short, they're tired, they're not sleeping, what's going on for them. And although the restrictions are really difficult for all of us, there are lots of ways to reach out to people and stay connected and support them, reach out to their family doctors, reach out to the clinical services that are still there and can be supportive and responsive to them. So I do think it's a really important time for us not to lose sight that this, this journey has been difficult for many, many people. And we have to remember that there are ways to still reach out to people and connect with them and get them the services.
Well said, Bob. Hey, I know you're really busy. We appreciate you joining us. Continued luck. Stay well and safe. We should mention again, your website is up to date, so www.vch.ca, and again, that phone number, 1-877-587-5767. It's Bob Chapman, Interim Vice President, Vancouver Community for Vancouver Coastal Health. Bob, thank you for taking the time. I know you're busy. We appreciate you joining us in this Richmond Sentinel discussion.
Thank you so much, and thank you for your time.
Cheers. Our thanks once again to Bob Chapman. More information on Vancouver Coastal Health. If you want to get some more information, you can go to vch.ca, and make sure you always check us out. It's richmondsentinel.ca. We're enjoying doing these segments. We're going to do more of them. If you have story ideas or if you have video segment ideas, please reach out to us. We'd love to hear from you. Thanks to the Richmond Sentinel staff here at the Richmond Sentinel office. I'm Jim Gordon. We'll see you next time.